Welcome. I'm Erin Reed, and I'm with Polaris MEP. Polaris MEP is a nonprofit consultancy that is dedicated to helping Rhode Island manufacturers grow. We are actually part of a NIST national network of manufacturing extension partnerships. That NIST network includes an MEP center in every state and also in Puerto Rico. Each one of us is tasked with helping manufacturers stay competitive and to implement best practices. Polaris MEP in Rhode Island provides consulting and training services. And we work with everybody from CEOs to the factory floor. We'll help manufacturers reduce cycle time, create quality management systems, and adapt to changing conditions. And certainly, the conditions couldn't have changed more in the last few months. The power of the MEP National Network is that we can share best practices with you that come not only from your fellow Rhode Island manufacturers, but also from manufacturers across the country. So this week's series of webinars are all about diving deep into Rhode Island Manufacturing Readiness Playbook. This was published by Polaris MEP and RIMA a few weeks ago. And we had heard from a lot of local manufacturers that it was rather hard to figure out which of the guidelines apply to them. So the playbook captures those recommendations that are most critical to your business. And during the webinars this week, you'll also get answers to deeper questions about acting on those recommendations. But it is kind of hard to see your hands raised from here, so I'd like to take just one moment to show the controls on how you can submit questions. For those of you who haven't used Zoom before, this is the Zoom control bar. And number one is where you would mute or unmute to talk. We have muted everybody so that it's easier to hear today's presenters. If you are not yet muted, if you can make sure that you keep that muted, that's always helpful. But number 6, that little chat bubble, is where we'd like you to go ahead and please reach out. Pose your questions for the speakers, type it into the chat field, and then I'll be able to pose that at the end of the session. Or if you're having problems troubleshooting, please put those there and I'll see how I can support you. And with that, it is done with administration and time for Christian Cowan, Polaris MEP Center Director, to get us started. Christian?
Thanks, Erin, and good to see a bunch of familiar names in the Zoom meeting. I appreciate it. I'm just going to start by giving a little perspective on how we got, through those last couple months and with this playbook. Certainly this has been an incredibly dynamic and confusing, evolving situation for all businesses. In Rhode Island, the manufacturers, luckily with the hard work of RIMA, the governor has allowed all manufacturers to remain open. So as a result, we don't have a incredibly dynamic, difficult transition to make in the manufacturing environment as other companies are doing in hospitality and recreation, et cetera. But there are some very important tenets that the state Department of Health and the federal entities have really come out with to make sure that the companies are protected. So we have worked with all of them, federal, state, and companies, employer partners, to put together this playbook, and it really comes down to the way we're putting it is screening, cleaning, masks and distances, or faces and spaces, as Erin likes to say. So we're going to talk about screening today, which is an important part of it. And in the last couple months, I have visited manufacturing companies. I've talked to the Department of Health. We have all, I think, together sat on conference calls with the state and the ones that RIMA has led. So this is a compilation of best practices and distinctions going forward for companies. So I'm going to talk a little bit about why screening helps, where and how to screen workers. I'll give some anecdotes of things that I've seen, and we all know that all companies are different. And then I will turn it over to Chris Goodwin to talk about Goodwin-Bradley. I think the incredibly frustrating thing for a lot of people is the changing nature of what we understand about the virus, how it infects people, precautions that we need to take, et cetera. And guidance has changed, both at the state, local, and federal level as well. So,
I'm going to give you the maximum for you. There you go. I'm going to give you the maximum, which is, you are here, right? Yeah. I'm going to leave it for RIMA, okay? From the regulation for you.
So what the guidance has changed in terms of how to work closely to each other, but you know, it seems obvious, and it's, you know, definitely all the experts are saying, if you have a company, a manufacturing environment that you're trying to run, and you prevent an infected person from coming into that factory, that is the best way to mitigate infection spread inside of your company. So far and away, maybe probably one of the biggest tenets of the playbook and the guidance is screening to make sure that an infected person doesn't enter your facility. So what does screening mean? There's all kinds of different questions and guidance there as well, but it's and it happens different ways, and I'll talk about the different mechanisms that different companies are using. But it's really making sure that an infected person, or doing your best to make sure that an infected person doesn't come in and infect others in your facility. I can tell you that I've worked with some companies over the last couple of months that have had an infected person or two enter their facility and infect other people, and the infection rate, the positive test rates, went up dramatically inside their facility. So they clamped down on several things, and one of them being screening, just to make sure that the screening is approached the right way. And the other thing that it's important for employers to make sure they get across to their employees, and sometimes it's easier said than done, is to make sure that they know that it's okay to go home if you're sick. I think as a culture, especially in the United States, many of us were encouraged to come to work sick. I have worked through illnesses in the past, and it is critical to make sure that all of your employees make sure that it's not okay to come in when you're sick. It's not okay to come in when you have symptoms. You know, there's enough problems trying to find the infected people that are asymptomatic. So when you have symptoms, it's critical to stay home. So how is screening taking place now? All different variety of ways. Meridian Printing has developed an app which has been passed around to a few different other manufacturing employers, and the screening starts with an app, and it asks you the key critical questions about how you feel, the questions from the Department of Health. You know, do you have a cough? Do you have a fever? Have you been close to infected people? So those screening questions on an app are one way to make sure that your employees are thinking about how they feel before they go into your facility. And it's also important that they take all those questions seriously, and they don't go through and just, you know, check all the boxes like we all do with the legal agreements and agree upon things when we all download apps. So not only is that app important, but it's important for management and the supervisors to impress the fact that all of those questions are important, and every single day the employees should really think about those questions as they check them off. You know, as manufacturers, there are often lots of people that enter your facility, whether it's a customer visit, someone dropping off, you know, a FedEx dropping off material, whether it's a trucker dropping off material, and all of your employees, be it production floor worker or office worker, signage, and really making sure that all of this information is front and center to everyone coming into the facility is really important. So signage is important. These are some images from National Marker, who is another great Rhode Island employer, if none of you know them. So signs that they're making, again, all based on CDC guidance from the federal level. The state of Rhode Island, it has published a few different documents that are important for employers to contemplate as they continue to keep their businesses open. There is a ReopeningRI.com website. A lot of it is geared for companies that have been forced to close over the last couple of months. Again, manufacturers, we've had the luxury of not having to close, but these checklists are all still relevant. A lot of them are high level, especially on the Commerce Rhode Island website, which is the reason that RIMA and Polaris have been working on a playbook to get much more specific as the manufacturing operations continue, and as we look at a reopening economy means ramping up production in a manufacturing facility means a much different dynamic in terms of people. So again, screening coming into the building, critically important to make sure that that infection stays outside of the building. If you look at what Commerce Rhode Island and the state is doing, they've done, and I've been part of a lot of conversations behind the scenes, they've done an incredible amount of research between health officials and other states in the country to make sure that offices open as safely as possible. Again, a manufacturing environment is different. It's a little bit easier if you work in an office with cubes where you have walls separating you, et cetera. But when you're on a production floor and you're working in a single piece flow environment where you're used to passing material off very quickly from one station to the next and not queuing things up, and material transfer going from one place to another, there are a lot more specifics on a production floor that need to be taken into mind versus just an office environment. So the checklists on the Commerce Rhode Island website are important. And again, making sure that, if you think about an infected person coming into a production floor where they really have to interact with people at some point, how do you make sure that that person's protected? And maybe more importantly, all the other people on the production floor are protected just in case someone comes in, any symptomatic person comes in that is infected. How do you screen? Companies have set up screening stations at the entrance to the production floor. A lot of companies have closed other entrances. So you have a main entrance for either office workers or, the few visitors that are coming in. And where there were 2 or 3 different entries and exits for production workers, they have closed all of them, and now there's only one. Obviously, you got to be conscious of fire codes. We've talked a lot about that with manufacturing companies, but really making sure.
Some like a 20, but they're not cleaning. I don't know.
Oh, sorry. Let me see if I can find that. So making sure that
try to get out there quick.
Making sure that, and if you could mute your phone, please, I would appreciate it. Making sure that who's coming in and out of your plant. Making sure that you ask them the specific questions and that they're answering the questions honestly is again important. A couple anecdotes I just want to make sure that everybody is aware of. I actually had troubles, I looked for it in a separate presentation, finding more modern images of time clocks. But there are all different parts of a production floor that need to be taken into account. It's not just a workstation where generally people are sitting shoulder to shoulder passing material back and forth, but time clocks where every production employee goes to check out. Now these videos are a bit on the dramatic side because there's so many people, but even if you think about social distancing these people and creating space in between them before they get to the time clock, if you look at these people and other people in your production floor, they're all touching the same cards and card holders. A lot of manufacturing companies now have biometric time clocks where every employee is now putting their finger on it or grabbing the same stylus. one company that I went and visited, they were looking for help from Polaris. They had a security entrance for all the production workers, and similar to an airport where they had bins and they all had to put their items in the bins. They're creating nice space in between the people, but all of the employees were touching the same bins. So it gets, there is an aspect of taking a step back and really looking at doing things different from a sanitation standpoint, spacing standpoint, et cetera. However, these are great points to introduce screening that that really hasn't happened at all in the past. So where your production workers come in, how to space them out, how to do staggered shifts so that they're coming at different times so you have time to screen them. And again, making sure that they're all taking all those questions seriously. A lot of companies have chosen, rather than do an app, to have somebody sitting at a table so they can do their best job to judge whether people are actually paying attention to the questions and answering them honestly is another choice that that I've seen some companies do here implement locally. And how do you maintain this going forward? You know, there is certainly, you know, as we RIMA and Polaris preach often, the continual improvement of the screening process, continual improvement of material flow is super important. So how do you pay attention to who answered positively or negatively to the screening questions, when they're allowed to come back to work, et cetera, logging that information. Again, the screening becomes an important data collection standpoint for any company. And there is very specific information about what happens in terms of quarantine, isolation, and when people are allowed to come back to work in the Playbook in both Polaris and RIMA. And with that, Erin, if that's okay, I will turn it over. I think I saw Chris Goodwin on the phone.
You did. In fact, he's logged in as Chris's iPhone. Chris, can you unmute yourself right now? And can everybody else mute so that way we can make sure we can hear Chris? He's going to share with us some of the ways that he and his team approach this.
Hello, Erin. I've unmuted myself. Can you hear me now?
You're the best. Thanks, Chris.
Thank you. So, yes, I'm Chris Goodwin. I represent Goodwin-Bradley. It's a small aerospace manufacturing firm right here in South Providence. You know, we were lucky due to our numbers. We've got about 20 people all under one roof. It was easy to get everyone together out in the parking lot. That's where we have most of our meetings now, to try to give everyone as much space as possible. We got everyone together and we said, you know, we're all in this together. Let's talk about some of the potential risks we got and how we can go about battling them. And a couple of our guys got together and prior to this conversation and had some concerns about pre-existing conditions. So we kind of formed two teams. We had essentially a high risk team, and which compiled over age was definitely a factor. So the older group out of our company, and also some people with pre-existing breathing conditions, any antibody conditions, anything like that that could potentially put you at risk more than the average healthy person. And then, so what we did with that was we broke up into two teams. And the first team, the at-risk team, they came in during the day. They came in early. Their day started at 6:15. And they would leave at 2 in the afternoon. Then there was an hour of cleaning in between shifts. And after that, there was the second shift would come on, which would be the less at risk. And that was compiled up of the younger, I want to say, you know, in a way, healthier crowd with less or no conditions. And that was a big help, you know, having having everyone kind of pull the rope that way, where you know everyone wants to be in that least risk condition or pool, but there was a lot of people that stepped up that said, look, I know it's going to be an inconvenience to work late at night, but they stepped up, and everyone shared in that, which was great. And that's not going to be easy for large corporations, I understand, but it was one of the things to help us, weather that storm up until now. Currently, we have decided that we are going to go all back on one shift, probably next week, and that's just due to us feeling like with the PPE, we have better controls. We have now, better sanitizer, more of it, more access to masks. So now we're not reusing masks like we had been in the past. There's been a variety of different measures that I think have been put in place to make us feel safer at work. And a lot of the screening, I know, Christian, you had started on that. That's where it really begins, and that's something that it cannot be rushed through. Asking a person, how do you feel? When's the last time you've encountered someone that, or if you've encountered someone that was sick or was found to be COVID positive? How are people feeling at home is a big one, because I've heard some horror stories where the people have been feeling fine, but they've got two people at home with temperatures. So just out of that potential risk, they really shouldn't be working too. And we've tried to offset people's pay wherever they've had a shortfall due to us making that decision of, look, Peter and Paul are at home sick. I know you're feeling well, but until they're feeling better and don't have any, don't show any signs of temperature, or exactly what they have, just wait. Better to be safe than sorry. Because in these under these times, we can't take chances. As far as lockout, we've had people that have to service the equipment and service the building. We've made it so they only come in during the weekends, and there's been a cost associated with that, because obviously there's overtime being paid on Saturdays when people are having to come in. But to service the sprinkler systems, anything, there's you don't realize how many times people come in and out of your facility until you really start monitoring it. But even ink from the copy machines, there was a person servicing that, and some of the stuff we've taken over and internalized just to keep as many people as we can out of the building, because you're not just keeping one, you don't know how many people that person has been exposed to. So there's that chain reaction effect there. And I think if we keep doing this and stay vigilant, and that's one of the hardest parts, is with, over time you become complacent. I'm probably, doing a walkthrough 6-7 times a day, having to remind people, hey, put your mask on, spread apart. How to wear your mask. It doesn't really do you any good if your nose is sticking outside of your mask. And over time, that's the hardest part. People do get annoyed with it. They especially the younger ones. The young ones, a lot of them, they see the numbers, the death rate, the death toll numbers, although completely high when you look at them overall. We're looking at like less than 1% death people that, come down with the disease. So it's hard to combat, especially when it gets 80 degrees outside. People are sweating, their masks are wet, they're breathing in their own, sweaty breath over and over. It's not a pleasing situation to be in. So that's one of the hardest parts for me anyway, is to constantly just be on them and try to explain to them, I'm trying to do it for your own safety, even though, you're thinking it's I'm being a pain in the butt. I'm not doing it for you. I'm doing it for everybody. And then after a while, they'll come around. They have a conversation with me, usually on the way going into their cars in the parking lot, saying, hey, sorry, I didn't have it on then. I know you're supposed to be wearing it all the times, and sorry, I gave you that look, and I understand, people they're overstressed at work anyhow, and this just it's unprecedented times working through this. It really is. It's unprecedented times.
Chris, it sounds like, especially with those other challenges on the floor, screening has become even more important for you, because if there might be some lapses during the day while you're at the facility, that's even more important to keep all the infections outside the door. Is that right?
Oh yeah, yep, yeah. We're currently right now, with the UPS, the FedEx, all the other metal distributors. No one gets in. Everyone has to, everyone has to buzz at the door. Then we come out. We meet. We greet them. We take their package, or we send a forklift driver out to meet them. But if anyone else that would, have to come in the building, the screening is a must. Because God forbid there is, you do come down with a case, you need to be able to trace back who was there, and who potentially they could be putting at risk. Because like they, tests have shown that you can have this up to 14 days without even knowing you have it. So just imagine all the people that you could potentially come in contact with over 2 weeks of time.
And Aaron, if I could make sure that everybody, I've had the fortune of knowing Chris for a while and understanding his business. If I could make sure everybody understands the important message that he's giving. I've personally worked with companies that have had big infection runs throughout their company. And, some of the companies I stand with on their production floor, and they say, I'm really worried about following the guidance. I'm really worried about, the state coming in. I'm really worried about getting inspected. And as I stand on their production floor, I said, what you need to worry about is, forget about the guidance and forget about the inspections, right? Because all of that guidance is still evolving. What you have to worry about is, see those people standing over there. If one of those people are infected, they're going to affect all the people around them. And then not only is everyone going to get sick. So, right, you heard Chris very clearly talk about, caring about the health and safety of his employees, but also it's going to hurt your ability to produce, right? It's going to hurt your business. There are companies, interestingly enough, there are manufacturing companies in Rhode Island whose business is dramatically increasing right now, but they've had infections run through their company. It's hurt their ability to produce product. So rather than focusing on the ability to pass an inspection, when I have the conversation of standing on the production floor saying, those people you don't want in your facility, because in the words of Dr. Julian from Department of Health, they look at that like a ticking time bomb and the ability to infect people. You want to keep them out of their facility. So, the important message is that Chris, you can tell Chris cares about his company, the people, and the business. And that's really the effect that I think everyone needs to pay attention to. And when you look at it that way, you start treating the guidance differently. You start looking at the screening differently. Chris's description of walking through and telling everybody to pick up their masks, like he's doing it for the health and safety of his employees and to keep his business going. And once you start thinking about it that way, it becomes a lot more obvious, intuitive, and you get, you know, a lot of the RIMA companies, you know, Chris included, getting buy-in from the employees is super critical to get them to understand you're not doing this to be a pain in the neck. You're doing it to keep them safe and keep the business running.
Right, right, exactly.
Great addition there, Christian. So Chris, before we let you go, because I know you're actually hopping in to do just that business, to take care of a customer right now, we did have a question that was specifically for you, and it was that after you've screened folks and you've let them in the building, you mentioned PPE. Are you giving people at Goodwin-Bradley a new mask every day? They were curious about how you're handling masks to your team members.
Yeah, so it all depends on what position they hold. Meaning, so there are certain positions like our people that work in composites. So the ones that are trimming with by hand, they're using respirators for the majority of the day. So those respirators, they get, you know, it's a full face respirator, and those are being sanitized every day. But while they're on the floor, they're using what are they? I want to say they're KN95 disposable masks. We were able to purchase those probably about a month ago. These, along with some other surgical masks that we were able to get through RIMA and through also, let me think, who was it? A&M Industrial had them as well for a while. You know, so we're trying to clean the reusable big respirators as much as possible, and we have people using those, and we're going through the disposable ones each and every day. You know, for a while we were using the N95s for probably 3 to 4 days in a row. We were using them because they're just, you know, I felt like they were so much better than just the cloth mask that we had access to, and everyone at GB has 2 cloth masks, but they don't fit as well as the N95s at all. You know, and where you have any gaps, there's exposure, there's risk. But also the big thing was the different sanitizers that are, you know, that are really anywhere now. I was just going through OSHA State Job Lot the other day, and they must have had 500 gallons of sanitizer ready to go. And, you know, a month ago, you couldn't find it anywhere. We were making, you know, our own hand sanitizer, mixing aloe and a 60% alcohol concentration, and we were wiping down surfaces because you couldn't find towelettes, sanitizing towelettes. You can now, but you couldn't then, or at least you can now if you're lucky. And so we were mixing up our own solution there with I think a 75% concentration of alcohol and 25%. I can't even remember what it was, some kind of degreaser agent, I think. But I think that's, you know, played a big part of it too, is wiping down every single surface. You know, we've closed our lunchroom so that there's, as far as eating in there, we do still use the microwaves and the refrigerators, but a lot of people are bringing in their own coolers. You know, I'm buying ice as much as possible to put in those coolers so that they can, you know, they have own means of keeping stuff safe. They don't want to go to touch the fridge. We've closed the time clocks, so now you're telling one of the office staff, you know, what job you're working on, when you got there, when you're leaving, so that they're not all touching the same mouse and keyboards throughout the building. So, you know, trying to limit that, I think, has also played a big part of it as well.
Wonderful. Chris, it sounds like you've really, starting with the screening and then on to those other things that Christian mentioned, the screening, cleaning, faces and spaces, you're tackling it all. Thank you very much, Chris. For those of you who have other questions about masks and cleaning, those of course will be webinars later in the week, and we encourage you to dial back in 2 p.m. every day. Christian, I did have a couple of questions that have come in for you specific to screening, if I can pose them to you. Thank you again, Chris Goodwin. Christian, one question was about temperature monitoring. And the question was, should we be doing it?
Yeah, so that question has been asked to RIMA, Polaris, the Department of Health, and the CDC many, many times. You know, unfortunately, the data has been very mixed. The Rhode Island Department of Health has talked about the asymptomatic people often, and infected asymptomatic people are just as problematic in a corporation as the sick people. So the symptoms, you know, early on it was, you know, dry cough, fever. The symptoms have kind of started showing up all over the map. So temperature is an indicator. It's definitely not an exclusive indicator. So as a result, both the Rhode Island Department of Health and the CDC have not mandated, have not required temperature screening going into employer facilities. However, there are a lot of employers that have started doing that. I know a couple of employers that have purchased temperature strips for foreheads and given them out to employees so that they can take their temperature before they come into the facility. That's been, you know, that's been one mechanism that people have used. Again, it is important to have a screening process to make sure that the employees are conscious about not coming into work if they are symptomatic, if there's a chance of them bringing the infection into a facility. So as the Department of Health, again, from a state and federal standpoint, continue to learn more and more about the virus, it's become less evident that temperature is an absolutely critical aspect of determining an infectious person. So it's not required. However, there are a few companies, they certainly haven't discouraged companies from taking temperatures or using that as an indicator. In a lot of the questionnaires that you'll see, even from the Department of Health, ask the question, you know, do you have a temperature of, I think it's 100.4 now, that number has changed as well. So even asking the question is helpful, but there is no requirement from a company to take a temperature. And the Department of Health hasn't said that is not an exclusive indicator, so they're not requiring it as well.
Thank you, Christian. Since you did mention data, we had a question regarding data. Have you seen any numbers on how successful health checks are?
I have not seen an indication of how screening, like I think the question is effectiveness of screening. I have not seen data based on the effectiveness of screening. I can tell you that screening is not only being recommended to manufacturing companies, but really all the companies that are opening up, not just places where people are going to sit and work near each other producing, but also in restaurants, in barbershops, et cetera. Screening is a very important tenet of doing their best to prevent the infection spread. There was a story out of Minnesota about a hairstylist, I think it was coming in infected, and as essentially interacting with a large number of people, 42 is in my head, anyway, a large number of people, and potentially exposing them to the virus. Again, highlighting the aspect of if that person would not have gone to work, would not have gone into the facility, they would not have exposed that many people to the virus. So, so that screening aspect, super important to make sure that that we do our best to keep the spread down.
Absolutely. Thank you, Christian. I know my mother went out for ribs the other day and was screened at the restaurant. So that was a good thing. We had one other question that I thought maybe you might be able to address, and that was regarding kind of, you said at the beginning, this person writes that it's the idea of people now ramping up production. We were fortunate enough not to lock down, but we're ramping up. So this person says, we've been doing okay screening smaller groups of people, but we're having a hard time figuring out how to screen 10 or 20 at a time. Are there any tips you can provide?
I can tell you what I've seen from other companies, and you know, Chris has got 20, maybe he's got a perspective as well. But other companies have done a variety of different things. They have set up staggered shifts. Not easy to do. I've worked my career in manufacturing, so I understand the logistic difficulties of setting up staggered shifts, but that will reduce the amount of people that come into your facility at the same time, therefore reducing the number of people that you screen at the same time. Generally, the difficulty in that I've seen of people screening, you know, 10, 20 people at the same time is the queue, the line of people that are lining up at the door. That's typically outside, you know, on a day like today, it's kind of easier to do, making sure that people space out. On a rainy day, it's a little bit harder to do. So there are companies that have put policies in place where, you know, there can be only 2 people that are going into the screening area at the same time. If you see 2 people at the screening area, meaning the door, the entrance door, to stay in their cars and wait for the line to go down, or the, you know, for it to go, you know, say less than 5. And that way it limits the large queue of people that will sometimes get closer to each other than necessary. And that keeps the line of people down, and, you know, the people, the employers are also, you know, they don't punish. There's no penalty for people coming in late because they understand the queuing problem sometimes happens. So those are a handful of different mechanisms. I would also like to say, you know, talking about queuing and people potentially waiting in cars, some of the I guess I'll say more problematic areas that we've seen recently is where the management of the company is completely bought into the importance of screening, the importance of all PPE. And sometimes that message gets lost in kind of the supervisor level, because the supervisors are trying to get product out as quickly as they can, just like in a normal environment. So it is important, you know, and Chris talked about it, it is important for everyone in the company, you know, management to supervisors to production people to office workers, for everyone to understand the importance of all of these areas. And, you know, production efficiencies are generally taking hits here because of spacing, material changes, flow changes, et cetera. But when you talk about, you know, people queuing up to punch in, coming into a building, screening, kind of having patience and making sure that everyone is safe about doing those right now is more paramount than production efficiencies.
Thank you, Christian. We have another question that has come in that I don't know if you want to punt it to later in the week from Mary Johnson, because it's about do half or full face respirator masks with valves offer required cough and sneeze retention? Do you know that, or should we punt that to Mary on Thursday?
So what the Department of Health has come out and said is largely to leave the technical masks, the N95 equivalents, the one with filters on them, to the frontline workers, to the medical community. So there are not a lot of companies, you know, so there are production areas that I know in the state of Rhode Island that require respirators because of painting, because of dust, et cetera. Those requirements don't change at all. However, people on a standard production line, for that cough and sneeze, so to speak, the CDC and the Department of Health is saying keep the technical masks to the frontline workers, the medical community, because they're, you know, still in a little bit short supply. And cloth masks are enough if they're sanitized the right way, if they're not reused over and over again. They're enough to catch the cough and sneeze to limit spread of the infection.
Thank you, Chris. All right, the last one is, okay, we've gone ahead and done all of our screening, but what do we do about screening employees who have previously tested positive for COVID? How do we know when they're able to come back to work safely?
Yeah, that's another good question that continues to come up, and guidance continues to change on that as well. So there's a couple different aspects to that. One is HIPAA laws do not require the employee to tell the employer that they were infected, and the Department of Health is not able to proactively reach out to employers because of HIPAA laws. And there have been a few employers reaching out to say, I'm trying to protect the other people in the company. I'm not looking to punish anyone, but those laws have been in place for a long time, and the Department of Health is standing strong by them. So it is up to, those decisions are up to the employee. However, there is specific guidelines around testing positive and what that employee needs to do to quarantine, which is a 10-day quarantine. They changed it from 7 to 10, and they were talking about going up to 14-day quarantine without symptoms. So the idea is no fever, no coughing, etc. So so that all of those requirements are on the employees. I will say, I believe every instance that I have been involved with employers to date, the employee has been very upfront and communicating very well with the employers. The employers, frankly, and I think everyone, should not want them back in the facility. There's incredible Department of Labor and Training programs to make sure that that employee can keep getting paid, that it's not a burden financially on the employers. So there's systems put in place to make sure that that employee can maintain their income, can continue to be able to make a living, but not come in and spread that infection into other people in the company. So so it is the quarantine period with no symptoms before returning to work. And if the employee is willing to talk to their employer about it, then that's great. It kind of enables that contact tracing a little bit better, which again is also important in making sure everybody understands the infection profile in their company, and also to ensure that they are out of work and don't come in until they are symptom-free through that quarantine period.
Thank you, Christian. Well, that wraps it up for the questions. Do you have a final thought before we refer everybody? There's more information, of course, in the playbook, and there are 3 more webinars this week, but do you have any final thoughts on screening today?
I don't, other than a lot of I'm going to reiterate some of the messaging before. I think the employers are, a lot of them that I'm dealing with, looking at it the right way, which is, what do we do to keep our employees safe and healthy? And what do we need to do to keep our business operating? Because those two things go hand in hand. You need safe and healthy employees to operate. Again, the manufacturing community here, thanks to RIMA and the RIMA pledge and the governor, have stayed open. And now really it's up to all of us to make sure we take the best practices and the guidance from the Department of Health and implement that in a way that keeps all of us safe and healthy and operating. So so making sure you follow a lot of the guidance similar to the way Chris did, which is take it to heart and not just checking a box, makes a big difference for all of us.